In the next minutes, I would like to share with you some information about joint programming for neurodegenerative disease research, which is called GPND. Aging and neurodegeneration are one of the major global challenges the humanity has to face, together with energy, climate change, food and health. The forecasted global cost of dementia between 2019 and 2030 are dramatically increasing from $1 trillion to $2 trillion. So to try to tackle this terrible challenge, we need three things. The first one is to increase the critical mass of physicians and scientists involved in neurodegenerative disease research. The second one is to increase the funding dedicated to neurodegenerative disease research, which are 10 times less than in cancer research. The third one is to increase the number of collaborations globally. And today, I can say that GPND is the largest global research initiative aimed at tackling the challenge of neurodegenerative disease. The concept of joint programming is a member states-led initiative born in Europe. It aims to address grand challenges to EU and global society by coordinating national research programs to increase the impact and effectiveness of research efforts. The idea is to overcome barriers by new forms of long-term collaborations, by fostering and testing innovative approaches and science policy cooperations, by creating gateways for scientific excellence, relevance, and international cooperation, and to create strategic platforms for alignment. Joint programming relies on three pillars. The first one is a shared visions, where GPND countries engage voluntarily and on a viable geometry. The second one is a reactive management structure, and the third one is a common strategic research and innovation agenda. The scope of the GPND initiative is focused on the three domains of research: basic research, clinical and translational research, and social and healthcare research, and is focused on specific disease areas, among them Alzheimer's, Huntington disease, motor neuron disease, Parkinson disease, prion disease, spinal muscular atrophy, and spinocerebellar ataxia. GPND brings together, of course, researchers, but also national funding bodies, national research strategy, and investors and industry. Today, GPND, with 30 participating countries, is the largest global ND research initiative. We have EU member states, associated countries, and partners countries just like Australia and Canada. We're actively building collaborations with US, where we had exchange in 2018 and 2020 around 2 joint transnational calls, and we're exploring potential future collaboration with other countries just like Brazil, China, India, Japan, Singapore, and South Korea. The GPND relies on a GPND research and innovation strategic agenda. We designed our first SRIA in 2012. It's based on very large principles. It's a roadmap for research. For instance, we have the origin of the neurodegenerative disease, the models, the definitions, the therapies, health and social cares, and all this is supported by enabling activities. We refreshed it in 2019, and we have now a roadmap for the next 5 years, which is really updated. GPND also works with working group dedicated to specific topics, just like longitudinal cohorts, animal models, industry partnerships, and patient and public involvement. One of our major activities is the implementation of transnational joint call each year. And since 2011, we invested more than 200 million euros in these calls. In each applications, we need to have at least 3 teams from 3 countries, and between 20 and 189 proposals are applying per calls. Among this, per calls, we have between 100 and 1,000 team applying. We are supporting actually more than 100 projects with between 1 million and 8 million euros per project. We also offer publicly available tools and resources for researchers and stakeholders. We have a global cohort portal, a database on experimental model for Parkinson's disease, and a map of funded research, resources, and infrastructure of the fundings which are invested by the GPND countries. We also develop actively collaborations, interaction, and disseminations with WHO, with the International Alzheimer's Disease Research Portfolio, with the collaborations through academia and industry, with IMI, and also through a strong willingness to develop patient-public involvement. We have also strong actions on social media and webs about stakeholder engagement. We have a patient and public involvement advisory boards. We have developed communications networks to engage the community of GPND stakeholders and to ensure awareness of the importance of GPND among policy-making stakeholders at the European and national levels. The GPND impact, at least on the funding, which is one of the major pillars of the challenge, we measured how much money was invested in neurodegenerative disease per year in 2016. As you can see, it is 566 million euros, while at the beginning of GPND, it was in 2011, 370 million euros. So a very strong increase by 53% overall. What is more interesting is to see where this increase is. And you see that if you look to the increase in the investment over 500,000 euros, is there was the biggest increase in terms of number of projects, in terms of amount of money as raised. So you see that GPND calls were a major factor in this change. But neurodegenerative disease is part of the question of brain health. As you know, brain health and brain disease affect 380 million patients in Europe alone, with a large variety of disease, a large heterogeneity of disease, and a lot of complication and disability. That's why the different initiatives in Europe were acting for brain health, as GPND, as the IRANET neurons, as the EC flagship Human Brain Project, as all the scientific society from the European Brain Councils, together under a banner of a European brain research area, are trying to synchronize, exchange, and optimize the research in brain health. And what we hope is that this grand challenge could be supported by a future partnership for Horizon Europe. If you want to keep updated with GPND activities, please visit our website, email us, follow us on Twitter, and you will see how this challenge is progressing and how the tools to tackle this challenge are strongly supporting research. Thank you for your attention.